with this, I'm now handing over to Oliver Semler, who is our speaker and has been the leader of a very important research project called A Consensus for Physical Rehabilitation Children and Adolescents with OI. I'm very grateful that you're joining us today, and I would like to hand it over to you for a quick introduction.
Well, good afternoon, everybody. I apologize for the not working camera on my screen, so you have to watch Dagmar the whole time. I'm a physician working at the Children's Hospital at the University in Cologne and had the honor to chair the consensus group of a lot of extremely experienced physiotherapists and occupational therapists, which worked together during the last 2 years to come up with some consensus on how physiotherapy and rehabilitation should be performed in children with OI.
Excellent. Thanks, Oliver. My name is Dagmar Mecking. I'm the director or CEO of Foundation Care for Brittle Bones. And what we do is we support research into OI in many different ways. And happy to talk to you on that topic in any shape or form. Let me start by showing you the agenda today. So we will speak a little bit about why this research was conducted and who was involved. The process will be explained. But most importantly, we will be talking you through the statements that were developed by the expert group. And then we come to the next steps and how to get involved in the future. Anyone on this call could potentially join in to make things put things into practice. So that is really the purpose of this call. And last but not least, we will close with questions and answers from your side. So during the entire call, please, if you have any questions, type them in under the questions and answers functionality, and we will look at them during the webcast and pull them out and share some of the answers later on. Let me start by talking a little bit why we have supported this research project as Care for Brittle Bones. You all are aware that with the experience that we've seen in the poll that everyone has on this webinar, OI requires a very structured approach with very different, has very different aspects to it. There is treatment with medication, there is orthopedic interventions, but importantly, physiotherapy and occupational therapy also is a part of therapeutic approaches that are used widely, not in all countries I know, but in most countries. And what is striking is that many people are spending time with physiotherapy. I've asked that on Facebook at some point in time to the OI community. And the most frequent response we got was that people are spending countless hours on physiotherapy. And yet there's not a lot of consensus and research and guidelines around that. And this is really why we felt more method was needed and a more deep approach to what is the latest state of thinking and what are the areas that really require more research as well. So here we are. We do have published this month, very hot from the press, so to speak, a consensus statement now, thanks to Dr. Oliver Semler and the entire expert team that has been involved. So it has just been published, and we're happy to talk you through those findings. The goal of it all is to achieve a positive impact on children with OI. So I really would like to emphasize that point, that it's nice to have research, but in the end of the day, it is about bringing some concrete added value to those children and adolescents that live with OI. And we can do that by providing more guidance and recommendations to PTs and OTs, and that will no doubt increase the efficacy and the focus of any physical therapy that will be given. It will also help to reduce risks, so that is important. But also, we really want to address the OI community and increase self-confidence and really encourage them to be as active as possible in their very unique personal way to make sure they can participate in life independently. And last but not least, we want to trigger some more research that is relevant in areas for quality of life of children with OI. But very much we realize this is just the start, and the consensus paper is an absolutely wonderful piece of work, but really it's important that people on the call take the responsibility as well to think how they can use that in their practice, and that we then see how we can also build on that going forward with more research, for instance. So I think I leave it at that, and I would like to hand over to Dr. Semler to talk us through the phased approach and the process to develop the consensus paper. Over to you.
Thank you. For creating this consensus statement, we tried first we had to bring together the group of the right people to work together, and we tried hard not to miss highly qualified people, and to identify all people who know a lot about physiotherapy and rehabilitation in OI. We tried to reach the whole group community of OI patients, parents, children, physiotherapists, and we did this by first contacting the patient organizations, by screening the literature, and also by looking around what materials and tools are already available and what has been published regarding research already in the past, to bring together the right people to build in the end a worldwide network of physiotherapists and occupational therapists to join their knowledge to bring it together in this consensus statements. Okay. Dagmar, can you? Perfect. In the end, we reached a group from really all over the world. We tried to limit it to one or two people from each country, so that the consensus was not influenced too much by the different healthcare systems of the different countries, to make it more a scientific approach, regardless of the questions, who is paying for physiotherapy and all these stuff, but going to the topic from a scientific point of view. And we were supported not only by Care for Brittle Bones, but we also had two representatives of patient organizations in the group who gave valuable input to the consensus group. But in the end, when we tried to fix the statements, these were only voted by the professionals. So this also gave you a bit of impression how the whole process was done, but to make it a bit more precise, we started by screening the literature, as you normally do when preparing guidelines, and this was a bit of a frustrating job, because it turned out that there are hardly any research studies and trials which have been performed on a high scientific level. In the end, we decided that 4 trials were somehow scientifically valuable and were discussed in the consensus statement and influenced it. To work a bit more in depth, we thought, how can we, and we is the group of the final 12 of the final 16 people who were part of the consensus group, which came up from the first search for knowledge. So in the first run, we sent out questionnaires and had a lot of respondents, with 90 respondents who said, well, we know a bit about physiotherapists and we do it in our setting this way and that way, but in the end, not many of them had a knowledge which was more than the experience of a few cases. So in the end, the group was limited to the 16 participants, and to work during this project, we decided to split the whole topic into different working groups, which are presented here. So 3 groups regarding function and structure, 3 groups regarding activity and participation, and others. So special things which were not very suitable for the other 2 groups. Okay. So during the telephone conferences and the group in the work groups, they finally wrote some first draft of the different chapters of the consensus paper and developed some statements, some very brief summaries of their chapters, and we discussed it then during the process and finalized it during a 2-day consensus meeting, which was held a year ago during the International OI conference, and afterwards it took a bit of effort to bring all the ideas together, finalize it, submit it, and revise it to the journal, and in the end publish it a few days ago. And now the first phase is done, and now the important thing is how to implement it and to make sure that the individual patient will benefit from this work we've done. So our idea was now to go a bit through the different topics and different statements of the working groups, but because the paper is published open access, so that everybody can have a look at it and download it and read it, I think the idea is to have a brief impression what you are most interested in, which area.
Indeed. Let me maybe come in here, Oliver. So I would like to ask you a quick kind of housekeeping question, so to speak. So first check how the technology works for you, and with a little poll. But then indeed, as Dr. Semler was saying, let's look at which topic and which chapter interests you most. So let me pull up the second poll. And you hopefully can see them on the screen. So the question is, first of all, let us know how this webinar works for you so far. Can you please indicate which of the options applies to you from your perspective? And then secondly, what area within the consensus paper would you like to hear more about, so we can really focus the conversation on those topics. I'll give you another 3 seconds to make your votes visible. And I'm closing the poll now. All right. And let me share the results so you have them visible. So generally people can hear everything and it seems to be going well. And there's some issues, and I saw somebody raise the hand as well. So hopefully we can learn from this experience and get better next time around. But good to hear that most people are fine. So, and Dr. Semler, for you, the biggest interest, it's spread quite well across, but it's musculoskeletal is definitely in a priority area, spine as well. But it sounds like you have to say something about all of the chapters. So I'll probably stop sharing the poll and hand it over to you again to talk us through those aspects.
Well, thank you. Yeah, that reflects very nicely what our impression during this have been, that it is very difficult to say which part is most important for a child with OI, and that in the end all the different aspects have to be thought over and have to be acknowledged during the therapy. So what our first statement was, and our main topic which influences all other areas, was that first of all, physiotherapy has the goal to improve the participation, the mobility, the function of the child, and not primarily focus on the positioning of an extremity, avoiding contractures or things like that. The main aspect was to maximize the mobility and independency, and that this is very often limited by fear and not enough motivation of the patient, families to try new movements, to establish new transfers, and that the fear is really a limiting factor in the physiotherapy of the children, and that this should somehow be also treated either with a specialized psychological treatment or as good as possible during rehabilitation and the therapies. So, because this influences the whole therapy in all different areas. Okay, so after these general recommendations, we thought, well, OI is a disease which primarily affects the musculoskeletal system, and in this area we all agreed that the optimal muscle function is the goal to reach independency and mobility, always having as the overall goal the mobility and independency and participation of the patient. So not trying just to increase some parameters which you can quite easily measure, but the important thing is the participation in society of the patient. And of course, after an acute problem like a fracture or surgery or immobilization, the activation and regaining of the activity is the important thing to start. And we all agreed that the therapy should start as early as possible after fractures, and that it is important to evaluate and somehow measure what is possible, what is necessary to avoid immobility. Okay, so I was quite surprised that about the results of the spine discussion and the spine group, which obviously was also here in this webinar a very important point. But when we discussed the spine subject in the working group, there we saw that everybody said, well, scoliosis is a major problem in the in patients with OI, but more or less all therapists agreed that there's not really a specific therapy how you can treat and influence scoliosis, and that is also the situation in the scientific literature. There is not much you can do against the worsening of a scoliosis. So our statements and recommendations focus really on the, not on the spine, but more on the trunk, that the muscles of the trunk should be strengthened to decrease back pain and improve pulmonary function and capacities, and to stabilize the patient for sitting unsupported and sitting in longer periods. And a few reported they might have positive experience with soft braces, but in the end it is not proven that with bracing you can influence spinal deformities, and therefore it was not decided to recommend such a treatment without any further research in the field. So that's was what we agreed on the spine. And to summarizing the spine, well, it is a huge problem for the patients, but at the moment, from a therapeutic point of view, we cannot do much against the worsening of the deformities.
Can I just very briefly come in here, Oliver, and ask people that have questions about this topic or any of the other topics to please make sure they flag that in the Q&A part. We have not received any questions yet, so it would be very helpful if people can type in their questions there, and we'll pick them up later on. Oliver, can I ask, is there some background, some child working with you in the background, or where does that come from? Because I hear some noise.
I hear a lovely child, but it's not around me.
It's not around me either. That's that's very, very special. Not clear where that comes from. So I will try to resolve that. Just wanted to clarify that in between. Okay. Over to you again.
Okay, so then the next topic which we thought we tried to combine in one working group was the topic of training of the upper extremities and self-care, because they are very closely connected, and these is the main focus because activity and use of the upper extremities really limits the capabilities of the patient to be independent and to participate in daily life activities, and especially also in self-care. And we agreed that even if therapists normally try to focus on strengthening and not using that much of assistive devices, especially regarding the upper extremities in the focus of self-care. Assistive devices are frequently needed and are necessary for the patients, and to during the therapies, compensatory strategies should be learned and tried to compensate for deformities or muscle weaknesses to to offer the children independency in their life. So then, as you can see by the number of statements in the different working groups, we all had the impression that the support of the child during infancy and to promote and improve the development during the first few years is extremely important, and that rehabilitation should start as early as possible and is not only a topic between the therapist and the child, but needs also to involve the parents, the caregivers, and whoever is together with the child. So there's a lot of teaching and education involved in the rehabilitation of children with OI, and all these caregivers need to be need to learn how to handle the child, and how to integrate him into the family life, with also minimizing the risk of fractures and the increase of deformities. So in this topic, it was decided that it is important to state that even if you are extremely cautious and if you don't make any mistakes, children still will fracture in the future, and that they of course should use some special methods for handling the children, like using wide hand support and gentle movements and announcing what they do, especially for the children a bit older. It is important that they know what the caregiver will do, where they will be lifted and things like that. But regardless of a very good therapy, fractures will still occur in the children. But this interferes with the topic from the beginning, with the generalized fear, which limits the motor development of the children. So regardless of the risk of fractures, it is important for the children to change positions, to start lying in a supine or prone position, lay on the side, so that the child has different perspectives, and different positions are also important for the formation of the skull. So, and we all agreed some children develop like healthy children, some develop their own way, and that you cannot use the normal milestones to assess the motor development in the children. Okay, next. So when the children get older, mobility is the main focus of the therapy. This needs to be adapted to the severity of the disease, so it is very difficult to make some general comments. Children can either be trained for walking independently or with different aids. The use of assistive devices should always be in a way that they can participate in all activities at school or outside school, and the aim is always to maximize mobility by optimizing muscle function and reducing the risk of fractures or skeletal pain. And therefore, in some patients, it is recommended to use assistive devices or wheelchairs to give the child the possibility to participate. And the final working group was about the therapy directly after surgery, because this is a bit different to the general training and rehabilitation. The children have to do their the coordination between the different disciplines is most important, so that the therapists know exactly from the surgeons what can they do, what range of motion, how much weight are allowed on the operated extremities. And in many patients, after the direct post-surgery training, rehabilitation to learn and train new movement strategies is important. So these are the general statements we were able to consent, and in all working groups the impression was that more research on a really valuable scientific level is needed to improve further physiotherapy and rehabilitation in the children.
Thank you very much, Dr. Semler. That was a very good summary of the key statements. I see that we have one or two questions already coming in from Yaskiran, so thank you very much for being the first one to use the question and answer functionality. I would like to pick it up briefly in terms of what's next. And I'll try to go fairly fast so that we have some time to answer one or two questions at the end as well, and do not worry, we will make sure other questions are summarized and responded to in the next newsletter. But important that we do not just now stop at the scientific work, but really see how we can use things in practice. So from the consensus paper to making a real impact on the quality of life of children, there's many more steps that are needed. You see them here on the staircase. Starts with creating visibility in terms of talking to colleagues during conferences and meetings, just people around you, to make sure they are aware of the consensus paper, and also the other tools and experiences that are available to them, and I'll talk to you more about this and the way you can access them. But in the end of the day, it's all about putting things in practice, considering how your current practice maybe deviates from what the recommendations are, and together continue the learning. learning from mistakes, learning from the successes, and deepening the learning through research. And I give a couple of examples how that can be achieved. So a quick one on visibility. Visibility of the consensus paper. It's just been published. So again, if you don't have it yet, make sure you read it. Very interesting, more detail for each of the topics that you've heard already about. We have also received a lot of interest from a very wide audience in Germany through an award that was given to this project. And again, congratulations to Dr. Semler and Brigitte Mueller for this. And the award was the German Child Protection Award, and it was handed over in Hamburg this year, June, so very recently, and definitely draw a lot of attention to this work. We will also produce a couple of videos. They have already been recorded by Marleen Schuring in the Netherlands, who has been part of the expert team. And you see here a recording session that she was doing. And she very nicely summarizes some of the key messages. It's also good to just share that through social media to gain the attention for the topic and share about OI in general, create the awareness that is needed. But then let me move on to other things you can do to personally get involved in this area and to help produce more impact for children with OI and adolescents with OI. So here comes a couple of ideas around sharing knowledge, tools, and experiences, which is really a space open to everyone who is called in. So we now have a bit of a network going on, as you may have noted. We have the experts, but frankly, they started this for various reasons. We know there are other experts out there, and everyone is invited to be part of a network which is completely non-hierarchical, frankly, and everyone with good ideas and lots of energy is most welcome. We will hold the next webinar probably in 3-4 months' time, just before Christmas. And if you believe you have a very relevant topic, feel free to let us know and we consider that for sure. If you have received the physiotherapy newsletter, that's good. Maybe you know of colleagues that also would benefit from it. Pass it on to them. We will make sure that the information is also available as a slide pack, so you can easily share that at conferences you may be going to. I know at least 2 conferences, one in the Netherlands and one in the UK, I think, where this will be shared, so that's good. We will also make sure we have some teleconferences maybe on the topic with groups that are interested in specific topics. Think of occupational therapy, for instance. Kathleen Montpetit is working on something very interesting there. So maybe we can create some communities in that area that dive deeper into one topic. Write an article for the physiotherapy newsletter. But most importantly also, I would like to draw your attention to the resource library that is not live yet, but hopefully will give us plenty of space to share more information. And I'll just give you one example here straight away, which has been shared by Miguel Rodriguez Molina, one of the experts coming from Spain, and he's worked on that together with AUCE Foundation, some subsidy from the Spanish government, and Claire Hill. She helped to make sure it's available in English. It's a very practical example of guidelines how to handle children or babies. And I really think this is a very nice way when people are firstly hearing that they have a child with OI to support them in a positive way, make things practical, not too complicated. So an excellent example. So this and many other resources will be available to everyone here, all people in the OI community just as well. And it will be on our Care for Brittle Bones website. So we will make a resource center to make sure everything is available. And you see here on those little clouds a couple of the things you can expect. And it's not long to go. Probably we launch it in October, but we fill it up with more information in the month of November. You will have videos there. That can be educational, like the one on the top right-hand corner from Claire Hill around understanding your spine, or the one from Camilla Lahart about baby handling. And there will be other videos that are more directed to the OI community, to activate them to be mobile and to engage in physical activity. There's specific things for occupational therapists, and we hope to receive contributions from people that are in the occupational therapist community through Kathleen Montpetit, so tips and tricks for daily living. I think it will be of great practical value, and the more you are helping us to access and everyone to access, the better the impact will be. So that's really wonderful. I'm moving on to the topic of research. Dr. Semler mentioned it already. The topics that you can see on the screen now have been identified by the group of experts as topics that require more work. So please consider that for the future. And very last but not least, I would like to pitch the idea of coming together in a workshop during the international conference that Care for Brittle Bones, together with the OIFE and the OIF, as well as the ERN Bond, will be holding in November next year. You see the date on the screen. I hope you will hold your agenda free for those 4 days where we hope to gather a lot of people, both from the professional side, but also from the OI community side, to discuss this key topic that connects us all. And having a workshop there for physical rehabilitation seems like a perfect timing and could be prepared well by a couple of people on the call and from the expert group. So if you're interested in that, please, again, consider that and let us know. I would now like to close that part and come to the questions that we have on the call. And I'm not sure if other questions have come up. Let's see if I can. Oliver, can I ask you to tell us if you have read any of the questions and if you can answer them?
Well, I'm trying to answer them. One question is quite easy to answer. It refers to the post-surgery rehabilitation, where we focused our statements on the surgery of the legs. We did that not because we think that rehabilitation of the upper extremities of the arms is not important or something like that, but the scientific knowledge and experience about rehabilitation after surgery of the arms is very, very low in the area. So we thought we limited our statements to the areas where we have some good knowledge, but there is one research was performed in Montreal looking at the function of the upper extremities, and I think this is definitely a topic also a bit included in the working group of the upper extremities and self-care, and is an area for further research. Two other questions we received belong to the spine subject and focus on the area what sitting devices are used, and if we have any information about the development of scoliosis in regards to the age of sitting or the positioning of the child in a sitting position. To be honest, we could not agree on any consensus regarding these topics, because everybody is performing the rehabilitation for the scoliosis and the back in a bit of a different way. And from my point of view, that is one of the areas which affect quality of life of the patient very much, and should be really one focus in the future to find suitable strategies to reduce back pain and to reduce the progression of scoliosis. But at the moment, we don't have this knowledge.
Clear. Thank you very much. I'm conscious of time. We started a little bit late, but it's important to wrap up in time, I think, to let people pursue the activities they need to according to their agenda. So I would like to encourage you to continue to send questions, which we can still respond to after the webcast, and launch a final poll, which will appear on your screen in a moment. So, number one, how useful or informative was this webinar for you? Second question, what are the next actions you would be personally interested in? You can respond to several of the answers there at the same point in time. So multiple answers are possible. And the last question is, will you use the insights of the consensus in your professional work? And it would be fantastic if you can respond quickly. I can see a couple of people have voted already, so that's good. I'll just leave it up for another 3 more seconds. So, okay, and let me end the poll now. See the responses coming in. I'll finish it. Yeah, I'm sharing the result. So useful, informative generally. Some way we can still improve, I'm sure. Secondly, next webinar is something that people are interested in. That's great to hear. Newsletter also being seen, and people are looking forward to see that. And there's interest of more than 50% in potentially attending a workshop in the conference in 2019, which would be absolutely fantastic. So, and also particularly pleased that nobody ticked the box of not interested in any kind of follow-up, obviously. Will you use the insights of the consensus? Most people said yes. 2 people said maybe. So I think it's fair enough. The webcast can just give you a first insight. I encourage everyone to go and take a look at the full document, which is definitely very deep and very well thought through. I would like to close the webcast now, but first of all, I would like to thank Dr. Semler as well as Brigitte Mueller, who have been leading this project for almost 2 years. Exceptional achievement also in terms of really leading everyone else to achieve that outcome together. I think not many projects have achieved such a big global effort in such an amount of time. So really personal thank you to you. Secondly, a big thank you to the experts that are visible on the screen right now. Very much expertise, but also just really that discipline of staying with the topic for an extended period of time whilst it's on top of their job is very special, and we owe everything in the end of the day to the people who have been contributing to this project. But also very much thank you to people on the call for this webinar. It was a first for many of you. We hope you enjoyed the experience. We learned from this webinar for sure, and we're looking forward to invite you next time around, probably sometime before Christmas. Have a very good day. Thank you very much for calling in.